Now, Dr. Harding is going to explain how clogged vessels from excess dietary saturated fats damage our brains.
Okay, so just so everybody gets a quick glimpse of a healthy brain versus a brain with dementia. This is Alzheimer's, but a brain with cerebral vascular disease looks very similar. So on the left side, now this is a coronal section. So if you were to cut the front of my face off from my ear to ear and just sort of slide it to one side, we call that a coronal section. So at the bottom of that your spinal cord would be going down there. At the top, that's the top of your head. So the first thing you can tell of these two brains is, one looks healthy, nice and plump like a grape. And then the one that has shrunken looks like a raisin. That's a simple way to compare these two is the one that has shrunk. If you go to someone like me or a neurologist and they're saying, well, you have brain atrophy, what they're talking about is that shrinkage that you see there. Now, the reason why it's shrunk, if you look at the Alzheimer's brain, you can see there's quite a few holes in there. And down there at the bottom, there's an oblong hole. Dr. Blake, if you move your mouse around, does it show up on the screen?
Yes, here.
Yeah, put it up near the hippocampus, up towards the right, just a little bit down. That's the
Here?
ventricle. No, over here towards the temporal lobe to your right.
Over here?
Oh, and then down one. Down that hole right there. See that? And you compare that to the other side, it's full of what's called the hippocampus. Now that hippocampus in Alzheimer's disease, it's you can see it's gone. That's the reason why somebody that has Alzheimer's will ask the same question 5 minutes later, because those brain cells are gone. So they're not doing it to frustrate the caregiver. They're doing it because the brain cells responsible to hold on to that information are gone. And we can see that very similar with small vessel ischemia. Dr. Blake, please go to the next slide. Okay. So what we have here is, again, this is a coronal section. And you'll see arrows pointing to certain things. And the first thing that pops out when I see this is a lot of spots that look like black pepper. Okay, those black pepper spots are small little infarcts that start accumulating in your brain. Surprisingly, in your mid-40s, middle age is when this process can begin if you have high cholesterol, hypertension, or high blood pressure, right? For those of us that have stressful jobs, you have to be mindful of these things, or else we can start having these spots. And some of those arrows that they're pointing at are kind of large. Those are areas that don't really work anymore. It's just scarring, and it just is not working. And as you can see in this picture that's got vascular disease, that place where the hippocampus on both those hemispheres is also missing. So Alzheimer's disease is not the only type of dementia that comes with memory loss. Small vessel ischemia can cost you your memory as well. Next slide, please. Okay, so how prevalent? Yeah, I mean, I put this in here just so you guys can get an idea. If you're thinking you have a pristine brain, yeah, that's a nice thought. But what we have here is small vessel ischemia, again, starts in your middle age. It's the most prevalent brain condition. It causes about 25% of ischemic strokes, 80% of intracerebral hemorrhage. That's quite a bit. And it contributes to 45% of all dementia. So like Dr. Blake was saying earlier, a mixed dementia, Alzheimer's mixed with vascular disease. It's what I see here in the clinic more than anything. And the good news is, as Dr. Blake will tell you, is the vessel piece, you can stop it in its tracks. Next slide, please. All right, so I like this picture. because it shows, you know, if you look at the bottom there at the base where your spinal cord is, or your neck would be, you got that large artery, that's called a carotid artery, and it's nice and big. But as it goes up and branches out into smaller and smaller areas, those small areas are susceptible to having a clot or a hemorrhage, especially if they're in the frontal lobe. So the frontal lobe is on the left of your screen. It's that piece, your eyeballs are sitting just underneath that ledge right there. And then the back of your brain, it's, as you can see, that's the cerebellum, but we won't go into that. Just understand that large vessels can have plaque in them that can break loose and go up into one of these smaller areas, and that's when you start having a problem. Next slide, please. Okay, so here's a good example because there's different types of strokes. The ischemic stroke, you got this blockage. If you look at the bottom left right there, you got some plaque in an artery. And let's say down below there was an embolism that broke loose and it's stuck. And so it pretty much blocks the blood flow, which is when you start having a stroke. And then if you look up above, you can see that gray spot where there's no blood flow going. And that means the tissue, if it's not getting glucose and oxygen, it's dying, okay? And then on the right side, you have what's called a hemorrhagic stroke or a bleed. Now, those earlier slides that you saw with those little black peppers, okay? That's these little hemorrhagic strokes. They can be as small as a transient ischemic attack that will be temporary. A lacunar infarct is a little bit bigger, tends to be in the subcortical areas, basal ganglia areas. But it just grows overnight. You could have one during the night. You wouldn't even know it if it's a small one. You wouldn't feel it. Next slide, please. All right, so this was kind of what's inside an artery. You know, Dr. Blake's going to tell you how to get rid of some of this stuff. So you can imagine, wouldn't it be nice to have a normal artery that looks nice and clean? I'm working at it. You know, Dr. Blake is changing my diet and I'm working at it. Truth of the matter is I probably have a little bit of mild atherosclerosis if I'm completely honest, but I'm getting rid of it because I'm changing my diet. And then there's this severe atherosclerosis where, now that's a large artery. It's supposed to have a lot of blood going through it, but not much is going through it in that little space because there's all of that gunk in there. Next slide, please. So I put this one in because I wanted you to see, this is a large artery where you see lots of red blood cells coming through. And yes, there's a little bit of a plaque in here. You know, we probably have some of that in our arteries, but blood can still get through. Now, one of those little red discs, that's a red blood cell. Okay, so that's a pretty big artery. But the next slide is going to be just big enough for one cell to get through. Next slide, please. So this is an electron microscope that is looking at this, what we call a capillary. And that little red disc that Dr. Blake is moving the mouse around, that's one red blood cell. Now imagine if it's so small that only one red blood cell can get through, what would happen if there was a little bit of fat on the side of that capillary? Okay, so, or let's say there's some plaque in there, but the brain wants some blood to go through there. It might raise the blood pressure up a little to get it through there. But either way, that area is in trouble because it's either going to have a small bleed or it's just going to stop in that small area. Now that's a small area. It's not going, you're not going to feel that. You're not even going to know it's happened until one day you're trying to remember somebody's name. You're going, what was that person's name? How come I can't think of that? So next slide, I'm going to show you what's going on in your language areas. Okay, so how do brain cells communicate? So neurons work with electrical and neurochemistry to communicate. They're constantly talking to each other. And here's a neuron A, and it sends an electrical message down what we call an axon over here to B. And then at the terminals, you've got the synapse. Let's talk about, say, dopamine. Everyone's heard of dopamine and Parkinson's and stuff. So they're going to, at the synapse, they're going to communicate with dopamine, but the electrical charge is going to go down this cable. You know, think of it like electrical cord. It's got insulation around it. And so you've got insulation around this little cable that's going to go over here and talk. Next slide, please. Now, that little cable, you've got billions of these neurons in your brain. And those little electrical cables get bundled up into what we call fasciculus. And so this is the left side of your brain. Again, your nose and your eyes are on the left side, so that's the front. And so we've got in the left hemisphere is our language regions. And we've got major language regions in the front, and we've got major language regions closer to where your ear would be, right? And then you even have to have the very back of the brain when you read something that gets involved for this language. Now, in order for you to put together a sentence or talk or even hear and make sense out of words, these language regions have to be in constant communication. So they're constantly sending electrical signals back and forth, back and forth. Okay, next slide. Okay, so now this is what we call an axial view. Okay, so at the very top of the screen, that's the front of your head. So your nose would be at the top. And the back of your head's down there where it says mild, moderate, and severe. So we're looking top down on your brain. And on you can see two hemispheres in each side. And there's these black areas we call ventricles. That's where your cerebral spinal fluid is. But right beside that ventricle or that black area, you see these white long lines. Now, that is what is called small vessel ischemia. So those communication lines that I was showing you earlier, right? They are being disrupted. So how bad can that be? Well, all of you guys over on Oahu know what H1 is like if one lane gets closed. It goes from nice, smooth flowing traffic to, oh my God, why am I not moving? And the same thing happens in your brain. If it's got slowed processing speed, you're not going to be able to have those language regions talking quickly and in a timely manner. And that's important because if they're not in sync quick enough, you might get distracted and forget what you were doing. You might go to the refrigerator to get something from the couch, and when you get into the kitchen, you forgot already what you were in there for. So that senior moment, part of it is this processing speed that you see here. Now, mild, you can see that if someone doesn't, let's say you love sausage and cheese. I like cheese, and but I had to give it up because my cholesterol was high, and I was growing some small vessel ischemia in my brain. And then if I don't change my diet, I could very well end up in this moderate section. Now, if you look at the moderate slide, you can see these white bands are getting thicker, which means more of those communication areas are damaged, and it's starting to extend out into the cortical areas where they're talking to each other. And then severe, now I can tell you this person over here on the severe side is probably what we call aphasia. They're having a hard time talking or comprehending what's being said because the communication lines are in pretty bad shape and their processing speed is really slow. Psychomotor speed is slow. Well, why is that so important? Well, let's say you're driving a car and everyone's whizzing by you. You need to have that sufficient processing speed to keep up with what's going on around you. If some little kid jumps out in front of you on the street and you don't have quick reaction times, that's going to be a dead little kid. And I have had patients come in here and admit to me that they've hit somebody at night because they couldn't see and they couldn't react in time. And so, we do the testing, and sure enough, they've got some of this vascular disease going on. Next slide. Okay, now it's not just, now this is a pretty nice picture of a brain MRI or a magnetic resonance imaging. I included this just so you could see, it's not just, if you look at this one on the left, you can see the white matter versus the gray matter, like that first slide I showed you with the healthy versus Alzheimer's. So the white matter on this left side looks pretty good, but over here where Dr. Blake is moving his mouse, this is not just small vessel ischemia in the subcortex, but it's also hitting the cortex over here in the parietal area. And that's going to cost you visual spatial abilities and things of that nature. And then over here, there's a severe one. It shows, oh my Lord, that entire parietal, some of the temporal is moved up into the motor sensory cortex. That's a pretty bad stroke. So it definitely can happen in the subcortex and small vessels, and it can happen at large events like you're seeing here on this slide here. Next slide. And just one more to drive a point home. I showed you an earlier slide of just small little peppers, but those little peppers can get even bigger. Now, this person here has got it extensively in the cortical and subcortical. This person is in pretty bad shape. It is at a point where they've got, this is probably moderate stage dementia. This is not mild stages. They have moved on to what we call a CDR of about a 2. And they're probably, if someone's taking care of them 24/7. Okay, is that my last one, Dr. Blake?
Let's see, I think that is. Thank you very much. You really scared us all by looking at what can happen to your brain.
Well, I tell you, you scared me, and that's why I've changed my diet. So
we call Dr. Harding the human MRI because he can test someone in the clinic and identify which part of the brain isn't working. And then when they get imaging, it proves the point that that really is the area that is having trouble.